Did you know that there is a very specific way that you are supposed to be exercising in order to reap the most benefits from your exercise when you have multiple sclerosis? It's true, and I want to teach you exactly what those things are, because even if you have the perfect exercise routine, if you're not incorporating these specific parameters, then you may find that you're not getting stronger or better balance or walking as quickly as you would if you were incorporating them. These 3 things that I'm going to teach you right now have been proven in MS research throughout the last year. So it's very up to date, and you need to be implementing them right now in order to reap the most benefits from your exercise. The first thing that research has shown is that distributed exercise is just as good as massed exercise. So what this means is that distributed exercise is exercising throughout the day. Maybe you exercise a little bit at breakfast, and then your lunch break, and then right before dinner. Whereas massed exercise is all at once. So maybe you wake up 20 minutes earlier and fit your exercise in then, or maybe just at lunchtime. Research used to show that doing exercises in massed amounts, meaning all at once, was better than distributed throughout the day. But that is no longer true, which is amazing because you can no longer use that excuse of not having enough time to work out as an excuse, because you can work out 5 minutes before breakfast, 5 minutes at lunch, 5 minutes here and there, and it is just as effective as working out all at once. The second update that I want to share with you is that your exercises need to be in variable environments versus a constant environment. So what this means is that you should be practicing your exercises in different rooms of your house, in different environments, maybe your home, maybe a coffee shop, maybe work, maybe a friend's home. And my best example of why this is a good thing to do is when I was treating a patient in the physical therapy clinic that I was working at, and we were practicing standing up and sitting down. Her husband came with her one day and said, "Dr. Gretchen, I don't know what you're doing in here that's magic, but when she's in front of you, she's able to stand up and sit down perfectly. But when we get home, she's unable to do it. She's plopping down, she's standing up with less strength, and it doesn't look as good. What are you doing here?" And as soon as he said that, I realized that it's not that she's weaker at home and stronger in the physical therapy clinic. It's the fact that we have been practicing in the same room, in the same chair since day one. So as soon as he said that, we started practicing standing up and sitting down in all of the different chairs that we had around the clinic, as well as different rooms. I would take her across the hall to the neurology office and we would practice there. We'd practice in our PT clinic. There was a bench outside, so we would practice in different environments. And then her husband reported a couple months later that she was actually showing better quality standing up and sitting down when at home. The third update that I want to share with you is that random order is better than blocked order. Random order means that you're doing a specific exercise broken up into pieces in random order. It's not the same order that you would do the exercise. And then blocked order means that you're doing everything in the same sequence that it should be done normally. It sounds kind of confusing, so let me give you an example. So I've actually talked about the 7 different steps that you need to do while walking in a different YouTube video, but we're going to use the same concept here for this example. In order to walk, you need to first be able to bend your knee, swoop your toes up, lift your knee up, straighten your knee, and put your heel down. So an example of a blocked order would be every time I practice this exercise, I do it in that order. I bend my knee, toes up, knee up, straighten, down. Every time I practice, I'd be doing those things. That's a blocked order. Research is showing now that it's actually better technique to do random order. So instead of practicing everything in the same sequence that it normally goes in, I would instead break up the exercises. So maybe I would do my knee bends first. Then maybe I would practice lifting my toes up. Then maybe kicking my leg out straight. So you just break up the order instead of doing the same sequence. And research shows that that is going to be better than the blocked order. Now I will say, once you get really good and stronger at doing the random order, you can then put it together in the blocked order pattern. So you can do both, but it is better, according to research, to do every exercise first in a random order. I hope these exercise parameters really help you take your exercise routine to the next level. And if you need help coming up with exercises specifically for your multiple sclerosis, feel free to head over to missinglink.com and check out all of the exercises that we have in that program. Thank you so much for taking your time to watch this video. If you enjoyed the content, please remember to press the thumbs up button, press the subscribe button, and share with a friend. And YouTube seems to think that you'd really like these videos over here, so if you have some extra time, go ahead and check some of those out.